The patient presented in the retinal OPD with decreased vision since 25 days in the right eye. On examination, patient had a macular hole with a subtotal retinal detachment of 8 clock hours, with temporal retinal break. OCT macular shows full thickness macular hole, with subretinal fluid. In this video, we present management of the retinal detachment with closure of macular hole using retinal autograft without the use of PFCL. We start with a central core vitrectomy using a 23-gauge vitrectomy cutter on the Alcon concertillation system. We induce a posterior vitreous detachment using active suction with the cutter. The vitrectomy is done along the peripheral vitreous base to the extent possible for removal traction around the primary retinal break. We apply endocautery along the supratemporal site for harvesting and procuring a retinal autograft. A combination of intraocular forceps and scissors is used to obtain a free retinal flap for filling the macular hole. We keep the retinal autograft on the nasal retinal side, and passive suction and fluid air exchange to remove the subretinal fluid, using the harvest site as draining retinotomy. We bring the retinal autograft and place in the macular hole, and the residual subretinal fluid is gently removed with passive suction. Laser barrage is done around the harvest site and 360 degrees in the peripheral retina. In the end, FGE silicone oil exchange is done for long-standing internal tamponade. Retinal autograft can be used in eyes with macular hole plus rhegmatogenous related retinal detachment, as it provides better visual outcomes. At 4 weeks, patient had well-settled retina with an opposed macular hole. The best corrected visual improvement was from 2/68 to 6/36 on Snellen's chart.